15 states setting weekly records for cases, 9 reaching new highs in deaths. The disease now infected more than 4.1 million people in the U.S. and killed more than 146,000, with more than 59,000 in hospitals.
Globally, cases have topped 16 million with more than 640,000 deaths. ABC's Stephanie Ramos is outside a hospital right here in New York City with the very latest. Stephanie, good morning to you.
Dan, good morning. For 5 straight days here in the U.S., more than 1,000 people have died each day from COVID-19. That's according to the COVID tracking project. The number of deaths going up after dropping throughout May and June.
This morning, Florida has surpassed New York to become the state with the second highest coronavirus cases. California, with the largest population in the country, has the highest. Some frontline workers are fearful as Florida officials start looking at how to reopen bars, closing them recently after a surge in cases.
We don't want to sacrifice our economy, but it can't be at the risk of the lives of our community either.
According to internal FEMA memos obtained by ABC News, 53 Florida hospitals have reached ICU bed capacity, several of those in Miami-Dade County, where an 8-year-old boy was hospitalized for more than a week with multi-inflammatory syndrome caused by COVID.
The secondary syndromes that stem from this are horrifying and terrifying as a parent.
Zane Wamper was on a ventilator for a day and is still battling the rare condition affecting children.
If I can help somebody else, another parent, not go through what we've been going through, it would be pretty helpful.
In Louisiana, hospital workers dealing with a surge. Military medics brought in to help with staffing as hospitals reach max capacity. Shortages in healthcare workers being reported from small towns to big cities nationwide.
We are incentivizing them with dollars, but at some point it doesn't matter how much you pay a person to work. They just can't physically do it anymore.
With COVID on the rise in 37 states and Puerto Rico and Washington, D.C., Dr. Deborah Burks speaking with our affiliate WXYX.
We're asking them not to go to bars. We're asking them to wash their hands and to not social gather with large groups of people.
And in Virginia, a reunion 103 days in the making. Luis Velasquez finally reunited with his family after battling COVID-19 for 3 months.
I realize now during this time how much you can love someone until the end, in sickness and in health.
And here in New York, once the epicenter of the pandemic, hospitalizations and intensive care unit admissions have hit a record low. Whit.
New York has been through some real heartbreak, so that is encouraging news. Stephanie Ramos for us, thank you. We do want to bring in Dr. Ashish Jha, director of Harvard's Global Health Institute. Dr. Jha, always great to speak with you. Thanks for joining us on a Sunday morning. I want to start in Florida because that state now has the second most cases in the country behind California. But Florida's Department of Business and Professional Regulation wants to actually start talking with bars and breweries about how to reopen again. Given what the state is going through right now, is it too soon to even start that conversation about reopening bars?
Good morning. Thank you for having me on. Way too soon. Florida is still very much a global hotspot. Over the last few days, it looks like it might be peaking, but it is many, many weeks away from getting to a point where it can even think about bars. There are 2 thoughts I have. One is if they think about opening bars, and if they open up bars now, they're basically saying goodbye to schools for all of the fall because the caseloads will be too high. And second, in this pandemic, it's not clear to me whether we can open up bars safely anywhere in our country, but certainly not in the hotspots.
You mentioned schools, the school year just weeks away in some places, and this week the CDC released new guidance for reopening schools, and they're really stressing the importance of in-classroom instruction, essentially saying the benefits outweigh the risks. What are your key takeaways from this latest round of guidance?
Yeah, you know, as a dad of 3 kids, I'll tell you, I understand the importance of in-class instruction, and I think we all do. And I thought that guidance from CDC was actually not very helpful because they just said, you know, schools are important. I think we all get that. The question is, how do we get kids back to school safely? And I think there's a lot more confusion, but the data and the science is pretty clear. in hot spots, it's not going to be easy to open up schools. And so we've got to bring levels of virus down if we're going to open up kids safely for our kids.
You mentioned those hot spots. What needs to happen in those places? We've seen a slight leveling off. Is that enough to get kids back in the classroom?
Yeah, unfortunately, nowhere near enough. And actually, if those states really wanted to figure out what to do, they could just listen to the secret documents that were leaked from the White House. The White House has actually been giving some good guidance, unfortunately, all in secret. I wish they'd make it open. And basically, what the White House is saying is shut down the bars, shut down indoor gatherings, shut down indoor dining, wear masks, everybody, and you have a chance of opening up schools later in the fall. But if you don't do those things, you really are giving up on the kids.
Oh, well, I want to get to testing here because we're hearing reports of some people waiting 16, 17, 18, 19 days for test results. I can tell you, I had a test here in New York. It took 13 days, and we're not even experiencing a surge right now. Nearly 6 months into the pandemic in the U.S., where is this failure still occurring, and how do we fix it?
Yeah, the administration has just never taken testing seriously. And these are, kind of national supply chain issues. This is not something that every state can fix by itself. As you mentioned, you can have plenty of tests available in New York, but you may not get results for 2 weeks, at which point it's borderline useless. So I wish we had built a testing infrastructure. Many of us have been calling for it from the beginning. At this point, the testing system is so badly strained that I'm worried that things are going to get much worse before they get better.
And they've got to do something if we want to get schools open soon. All right. Thank you so much, Dr. Jha. We always appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.